Good morning, ma'am. My name is student nurse Kau, and I'm going to be your student nurse for today. Can you please tell me your name? Miss Lamini. Okay, first I have to positively identify my patient and check in the file as well. Yes, indeed, her name is Miss Lamini, and I'm going to check her ID belt. Yes, it is Miss Lamini. So, Miss Lamini, today I'm just going to quickly assess you and check how you've been doing since you've got your baby. So I'm going to require you to just undress your upper body and your bottom body as well. Is that fine? Okay, so before I start, I'm going to wash my hands. Okay, my hands are clean. I did the social hand wash, and I'm wearing my gloves and an apron, and I'm adhering to the infection control protocols. So before I start, I'm just going to quickly do a quick history on Miss Lamini. So Miss Lamini is a 38-year-old woman. She's a grade 1 parasito. She's also diagnosed with gestational diabetes. She gave birth at 37 weeks gestation, and it was a normal vaginal delivery. However, she had an episiotomy and as well as a vacuum extraction due to poor maternal effort, and the baby was a big baby as well. And yeah, she gave birth. Her duration of labor was 10 hours, and yes, that's all. So Miss Lamini, how are you feeling today? Are you sleeping well? Do you feel tired? Okay, that's good. Is the baby feeding well? Okay, the baby is feeding well. Okay, that's good. And have you been going to the toilet? Have you went for urination, and have you also passed stools yet? Okay, she has passed urination and stools. Is your urine burning? No, it's not burning, and it's not painful when you urinate, and it doesn't smell as well. Okay, that's good. So before I start with my assessment down there, I'm quickly going to check for signs of jaundice. So I'm going to check her eyes. Her eyes are white in color, and the bottom of her tongue is also pink. There's no yellow observed. I'm also going to check for signs of anemia. Her eyes are nice and pink. I'm going to check for the capillary refill. Okay, her capillary refill is less than 2 seconds, and her hands are nice and warm. I'm also going to check on this side. Oh, sorry, ma'am. It is also less than 2 seconds, and her hands are nice and warm. While I'm holding her hands, I'm quickly going to pinch her to check for hydration. Okay, my patient is well hydrated, and there's no clubbing observed on both of her hands. Okay, I'm also going to check for any signs of cyanosis. Okay, there's no central cyanosis observed, and there's also no peripheral cyanosis observed. Okay, now I'm going to check for edema of her lower limbs. Okay, her limbs are not swollen, and they are both warm and well perfused. Okay, they're also not swollen over here. And can you feel when I touch you, ma'am? Yes, and she feels that as well. And there's no varicose veins as well observed. Okay, there are no signs of varicose veins as well. So there are no signs of DVT observed. Okay, I'm also going to check for hydration. Just going to quickly pinch her skin, and it comes back quickly, so my patient is well hydrated as well. So first I'm going to expose your breasts. Is that fine, ma'am? Okay, first now we're going to look at her breasts. The shape, the size, and the symmetry is normal. There's no red discolorations observed. There's no abnormal lumps that I can feel. And her breasts are engorged. There are no abnormal discharges except for the colostrum that she's secreting. We're going to go down to her abdomen. We're going to check her uterus if it's contracting or not. So I can feel her uterus. It's nice and hard. And we're going to measure it. So how we measure it, we look for the hard part of the uterus, and then put our tape there, and then go down to the pubic symphysis. So it's about 16 centimeters, which means it is contracting. In normal circumstances, the uterus contracts 1.5 centimeters every 24 hours. Have you went to the toilet yet? Okay, she has went to the toilet and she is passing gas as well. Okay, I'm going to palpate the bladder. Her bladder isn't full. Have you been to the toilet for number 1, for urinating? Okay, and is it burning? Do you feel any pain? No? Okay, does it smell? Okay, and it doesn't smell as well. Okay, now I'm going to expose your lower part. So we're going to check for lochia. So at the moment, she still has a lochia serosa, which is red and lasts for 1 to 4 days. So my patient has an episiotomy. When I check the wound site, it is red. It is a bit swollen to show that there's an infection going on here. And there's also some abnormal discharge. It's a bit yellowish. And also when I check the approximation of the wound, it is not closing well. Okay, thank you, ma'am, for allowing me to assess you. So tell me, how have you been feeling recently? Are you feeling well? Are you not feeling any sudden sadness? Okay, and are you happy to have the baby? Okay, that's good. And were you able to bond with the baby after birth? Okay, good. So skin to skin was initiated with the patient before her baby went to neonatal ICU. So the problems identified with Ms. Dlamini is that she has an infected wound, and she's also been diagnosed with gestational diabetes. So the first priority we have now is the infected wound. So the interventions that we're going to have is that we have to give Ms. Dlamini health education on keeping the wound clean and dry and changing her pads regularly. So she needs to clean the wound with normal saline or just normal salt water at home to make sure that the wound is not infected. And also she needs to wipe front to back when she's from the toilet. What can also be done is that she needs to get antibiotics for the wound. She needs to get amoxicillin 1 gram, and also a sitz bath for when she's still in the hospital or when she goes home as well. What we can also encourage the mother to do is mobilize and exercise and eat healthy as well. Since she's diabetic, she needs to keep her sugar levels at a normal level so that her wound can heal quicker and that she doesn't have any other complications. The second problem is the diabetes. So how we can manage it is that we need to monitor her blood sugar every 4 hours, and she's also being prescribed metformin 850 milligrams. So now I'm going to check the patient's prescription. So first we have to check for the patient's sticker if it's the right patient, and yes, it is indeed Ms. Dlamini's sticker. We're also going to check for any allergies on the prescription, and no allergies. She doesn't have any allergies, so yeah, there are no allergies written on the prescription. I'm also going to check for the medication, the name of the medication. So it's amoxicillin and metformin. So the doctor prescribed the right medication, and he also wrote the correct dose, the route, and also the correct frequency. The date and the times are on the prescription, which are written well and legibly. The doctor's signature is also on, as well as his rank and the hash number that we can get him on. Okay, so all the things that I've been doing today have been done under the acts and omissions of nursing, which is R387, and also under the scope of practice, which is the R2598. Thank you. Oh, before I leave, everything that was done, I'm going to record and report any abnormalities to the sister in charge.